Good morning. Good afternoon, everyone. Good afternoon. As folks log on, we'll give folks a minute to get in from the waiting room. Good afternoon, everyone. We're going to give folks a couple of more seconds to log on, and then we'll get started. I see some activity in the chat. It'd be great to say hello, good afternoon to folks. Also, throughout the conversation, we'll be providing some answers to some of the questions we got in advance in the chat, and also providing some links to how you can learn more about how to get involved with Philabundance and our partners. Thank you all for logging on. I know these times are busier than ever for everyone. Folks are now doing things both in person and virtually. And so thanks for carving out some time over the lunch hour to join us. I see folks that are logging on. I see some board members. I see some agency partners, I see some supporters. I see folks from Health Partners Plan, some members of our staff. Thank you all for joining us today. Looking for the thumbs up from my team to get started, and then I will start. I think we are good. Well, good afternoon, everyone. My name is Lori Jones. I have the honor and privilege of serving as Chief Executive Officer of Philabundance. Welcome to Philabundance Food for Thought, our virtual engagement series, Health and Hunger. We have a thought-provoking conversation in store for you today. So thank you all for logging on. We have a great panel and an equally great lineup of participants and all of you logging on. As I just noted, we have board members, we have partners, volunteers, donors. So thank you all. Philabundance, as you all know, as being some of our friends and partners, is the hunger relief organization dedicated to fighting food insecurity in Southern New Jersey and Southeastern Pennsylvania. And what you probably know, most people know about Philabundance, is that for more than 3 decades, we have rescued food and provided free groceries to people in the area. You've no doubt heard the statistics that we'll say a couple of times in this conversation, that we went from distributing 25 million pounds of food a year to 55 million pounds when COVID struck. What most don't know, however, is that in addition to giving the fish, we're also very much about teaching a person to fish through a program we call Ending Hunger for Good. Now, before I say more about the program, I want to share a personal story. So I went to the doctor. I have to admit that I neglected some self-care during COVID and took 2 years to find a new primary care provider and get a physical. And so I found a new provider and I had so much paperwork to complete that they actually mailed it to me in advance. But while there, I still had to answer thousands of questions, many of which I'd already answered in the forms. So, you know, they asked if I'd had any surgeries, what medications I took, what my family history was. And then they asked something that surprised me. The nurse said, now we're going to ask you about the social determinants of health. Do you or have you in the last year worried about having your utilities cut off? Have you in the last year worried about feeding yourself or your family? Safe nutrition, safe housing and nutrition are 2 of the social determinants of health. And the folks presenting here today are experts that will help us understand the connection between these seemingly unrelated to health factors and a person's health. And as we start this conversation, I want to remind you that we have just come through and really haven't escaped from a global health pandemic, one that took far too many of our loved ones and neighbors, one that disproportionately took those without equal access to these social determinants of health. And by the end of this discussion, I hope you will understand how and why we are redoubling our efforts, not just to provide food, but to provide healthy food to ensure the people we serve and our communities are indeed healthy. I'm going to flip through my slides here. To go through real quickly, food insecurity, we talk here about addressing food insecurity, and one of our colleague panelists will talk about this later. Here's a technical definition from the US Department of Agriculture, USDA. Food insecurity is defined as a lack of consistent access to food for a healthy, active, healthy lifestyle. And that really relates to not having the financial resources to provide food for families. What you see here is how food insecurity was really impacted in our communities during COVID. During COVID, we saw a 60% increase in folks that were accessing the charitable food network. And as I noted in the pounds that we distributing more pounds, we also reached more people. So we went from serving about 90,000 people a week to serving 135,000 people a week. Hunger and health is absolutely directly related. So you'll hear more about that particular social determinants of health around food insecurity from the panelists. But the reality is that we find that the cost to an individual, to their health, but also to our community and to healthcare system, the costs are high when people are not fed and don't have access to nutritious food. Here's some startling numbers to give you a sense and to think about it, I guess, in a slightly more positive way, what we could save. We could save over $87 million a year if we ensure that more of our neighbors across this service area of southeastern Pennsylvania and southern New Jersey had access to food. Equally high number, if we looked at just nearly $30 million would be saved, or $27.1 million could be saved in annual healthcare costs if in Philadelphia alone, we reduce food insecure individuals by just 1%. I touched on briefly the ending hunger for good. Again, folks know the work that we do, which is traditionally known as Relieve Hunger Now, the food banking side, the providing free grocery side. What folks know a little bit less is that we also made a commitment to really address the root causes of poverty and root causes of hunger through ending hunger for good. And one of our colleagues from the End Hunger for Good program will be speaking a little bit later today. One way that we really address this through ending hunger for good is through a workforce development program called the Philabundance Community Kitchen, but you'll also hear about other efforts through partnerships that we're looking to address food insecurity and partnering with others to address the other social determinants of health. Yes, it is. We're squarely in April, but last month was March. March is known as National Nutrition Month. And in National Nutrition Month, we actually introduced a new program called our Good Food Policy. And that's our commitment to address these 4 particular areas. First and foremost, and mindful of the fact that we are coming through this global health pandemic, mindful of the connection between food insecurity and health, we are redoubling our efforts to provide more nutritious food to our partners and neighbors in need across this region. We also are looking to provide more culturally responsive food, ensuring that we provide people with the healthy food they want, but also the types of food, the variety of food that they need and desire. We're looking to provide more equitably sourced food. So there we're looking to see how we can partner with local farmers, minority and women-owned partners and businesses to access this food. And then finally, accessible. And this is really about when our pantries are available, when people can access food in the charitable food network. We want to make sure that we're providing the food at a time that is convenient for families. And as we move on to, before we move on to the presenters, I actually want to read a quote to you that we got from one of our agency partners that really underscores the good food policy and this concept of health and culturally appropriate foods and what we're providing for people. One of our agency partners said to us, I really see and recognize all the hard work that you're putting forth in offering us agency support, and especially a better variety of products for our neighbors. When I tell you that the salmon that was received this week was like manna from heaven, we opened the boxes and distributed it to our communities. The outpouring of gratitude and elation was overwhelming. We literally had almost everyone say, wow, this is amazing. And for all of us, it definitely was amazing. In all of my years of Philabundance, I can say that we have never seen such an abundance of culturally relevant foods that are fresh and available to agencies. I mean, the jasmine rice, the dried beans, the fish. This is an absolute blessing to our folks. Our special thanks to Philabundance, recognizing the need to provide healthy, safe, and culturally relevant food for everyone. We really appreciate you and all that you have done and are doing for our families. So by the end of this conversation, I hope you do understand and ways that we're really trying to focus on providing people healthy food that they want and desire. I hope you also have ideas and understand how we can partner to ensure that we're really building a more diverse and healthy community. So with that, I now have the honor of introducing our presenters for today. I will introduce them all and then they'll go in order. First up, we'll have Allison Bovell-Ammon. I hope I pronounced that right. She serves as the Director of Policy Strategy at Children's Health Watch. She leads advocacy and communication strategies, focusing on growing and developing federal, legislative, and national relationships to inform policies that improve child and family health. She also currently manages the Housing to Health program in the Department of Pediatrics, a comprehensive program designed to respond to housing needs among patient families. After Allison, we'll hear from Joan Boyce, who is the Senior Director of Government Relations and Public Affairs at Einstein Healthcare Network. Joan works with government and nonprofit agencies, as well as legislative offices, to further advance the mission of Einstein to improve the health and welfare of the community. She serves as the lead for Einstein's Healthcare Anchor Network and serves on the board of one of our partners, Small Things. Next, we have Principal Pauline Chung. She's a principal at Francis Scott Key School. She served as principal there since 2016. Under her leadership, Key increased its school progress report scores dramatically. And in 2017 and 2018, she implemented a breakfast program that resulted in increased attendance and breakfast participation. Principal Chung is a special friend to Philabundance, as you will soon hear, an advocate for the well-being of our children. She brings nutritious food to her students and their families through welcoming, innovative programs and partnerships. And last, but certainly not least, is my colleague, Samantha Mogul. Sam is a senior manager for Ending Hunger for Good. She's a registered dietitian and has over 10 years experience working in food systems, both in food systems and with the public health sector. She also co-chairs Philadelphia's Food Policy Advisory Council and is involved with the library's culinary literacy program. So with that, I will turn things over to Allison.
Thank you, Lori, and thank you, Philabundance, for hosting this webinar today. I'm Allison Bovell-Ammon. You got my pronunciation perfectly, so thank you so much. And I'm going to tell you a little bit about our work at Children's Health Watch, just briefly talk about the state of hunger in the U.S., really building on Lori's terrific introduction, some research around hunger to health, and evidence-based solutions. So Children's Health Watch, we're a network of pediatricians and public health researchers, and our mission is really to improve health equity and improve the health and development of young children and their families by informing policies that alleviate economic hardships. We're headquartered in Boston with sites in Boston, formerly in Baltimore, Philadelphia at St. Christopher's Children's Hospital, at Drexel University, Minneapolis, and Little Rock. So in all of those sites, we talk to families of young children under the age of 4, about their ability to afford basic needs in healthcare settings. So we focus on a range of policy solutions to the social determinants of health, those have already been referenced, the basic needs that we know that families have to have in order to raise healthy children. So nutrition, housing, tax credit, and income, healthcare access, childcare, and home energy. So just sort of zooming out on a national level, we know from the U.S. Department of Agriculture, USDA, who collects information every year on families and individuals across the country and experiences of food insecurity, that we know that food insecurity in 2020 was on the whole not significantly unchanged from 2019 and held at about 10.5%. I will say when those of us who are in the field saw these data, we were actually quite surprised. And I think the potential of holding on a national level has a lot to do with the extraordinary relief efforts, both on the federal level and by terrific partners like Philabundance, to really buoy people during the pandemic. But when we dig a little deeper, what we know is that there are deep disparities and inequities in experiences of food insecurity across the country. So families with children have some of the highest rates of food insecurity. So in 2020, they experienced food insecurity at a rate of about 15%. And then when we dig even deeper, what we know is that certain demographics of people also experience very high rates of food insecurity, really linked to structural inequities and policy inequities in our systems. So female-headed households experience extremely high rates of food insecurity, as well as a number of racial inequities in experiences of food insecurity, with the highest rates of food insecurity, again, linked to historical racism and structural racism in our country, experienced by Black and Latino families. And so as our topic today, hunger and its relationship to health, the reason why this is alarming, even aside from the moral, ethical vision that everyone deserves the right to food, we also know that food is critical for health across the life course. So often when we think about how hunger impacts health, we might first initially think about diet-sensitive conditions like diabetes or hypertension or high cholesterol in adulthood. But really what, more than 2 decades of research has shown is that hunger impacts health from the prenatal period all the way through old age. So, pregnant people who are experiencing food insecurity are more likely to have pregnancy complications. Their babies are more likely to be born at low birth weight or preterm. We know in early childhood, this really, really critical moment of growth and of cognitive development, the vast majority of your brain is developed by the time you are 3, that hunger really is critical, that when you look at a baby, as one of our pediatricians says, when you look at a baby, they are all head, and all that nutrition is going to feed that brain that is growing. And it is really critical to grow the structure, the architecture of the brain in early childhood. And nutrition is key to that architecture. We also know that early childhood experiences of food insecurity result in poor physical growth, increased risk of hospitalization, iron deficiency anemia, which is linked to a number of health issues. And then in childhood, we continue to see as food insecurity persists, behavioral problems, anxiety or depression, academic concerns, things like asthma. And then, through adulthood, again, sort of poor overall health and lower nutrition intake and risk of failure to thrive in older adulthood as well. And so what we know, if we take a life course perspective, is that anytime anyone is experiencing even mild levels of food insecurity, that is a concern for health. And that is the reason why Lori, at her health appointment, the nurse was asking about that, because we know that it's so important for positive health outcomes. And as has also been noted, we know that this costs our health system an exorbitant amount of money. There's been a lot of estimates done on the cost of the health system. Some of the economists that work at Children's Health Watch have estimated it costs about $160 billion annually in excess healthcare and educational costs related to food insecurity. But the good news is that we have evidence-based solutions that improve health. We know that the Supplemental Nutrition Assistance Program, which is our nation's largest anti-hunger program, is effective in reducing food insecurity and improving health across the life course. And we know that child nutrition programs like school meals and WIC and summer meals and all of the programs that are really designed to meet children where they are and provide them nutritious food are really critical, not just for alleviating food insecurity, but also improving health outcomes. Finally, some recent research that we've done at Children's Health Watch has also specifically looked at pandemic relief policies and tried to understand how the policies that were rapidly implemented on the federal level impacted children in families. And so what we saw, what some national data really show is nutrition assistance programs and a study that we did around the advanced child tax credit payments reduce food insufficiency, so reduce an extreme form of food insecurity among families with children nationwide. And then our own research among families with young children, we saw that the economic impact payments also significantly reduced food insecurity among families with young children. However, even with these amazing outcomes of reducing food insecurity, we know that there were vast inequities in ability for families to receive those federal assistance programs. As you see there on the right, we see that immigrant families were much less likely to benefit from these important relief resources. And so there's a lot that we can do to really promote health equity by reducing food insecurity. And I know that a lot of the people on this call today are focused on serving communities in need. And I think there's also an opportunity, in addition to the amazing work that you all are doing, to share those stories with federal lawmakers and your state lawmakers to really drive robust investments in nutrition assistance programs and other programs that significantly reduce food insecurity. We have an opportunity to expand the advanced child tax credit, which lapsed at the end of this year. And we know how important, just getting financial resources into people's pockets is. And then finally, removing administrative and structural barriers that so many families, particularly families of color and immigrant families, face in accessing economic resources is really critical on a structural and policy level. So thank you so much, and I will turn it over to my colleague.
Thank you, Allison, and thank you, Lori, and thanks, Philabundance, for hosting this event for everybody. I think my first couple of slides are going to reiterate what Lori and Allison both said about the importance of health and nutrition. A lot of people are confused about what the difference between hunger and food insecurity is. So just reiterating what Lori said is that hunger is just a physical sensation of being hungry, but food insecurity is really the lack of access to enough food for a healthy and active life. If you flip the slide for me, I'm sorry, I don't have control of those. While poverty is a major driving factor of food insecurity, if we dig deeper, single moms with children are the most prevalent that we find to be food insecure. And Allison touched on that as well. But children are twice as likely to be in poor health. Adults are about 40% more likely to have one or more chronic conditions and more than 3 times as likely to skip needed medications. And seniors are 40% more likely to report congestive heart failure and 53% more likely to report heart attacks. Go ahead and flip the slide. Food insecurity on healthcare also in adults, 50% more likely to go to the ER and be hospitalized on average and have about $1,900 per year more in healthcare costs to themselves. Food insecure adults with chronic diseases have more healthcare expenditures in general, but food insecure adults with the same diseases, with heart disease, they have $5,100 more per year in cost. With diabetes, it's $4,400 more. And with hypertension, it's $2,200 more. So it's a significant cost to the patient as well. Go ahead and flip the slide. In Einstein's community, Einstein is considered a safety net hospital We serve a community that is very underserved, very high Medicaid population, high Medicare population. 45% of the families have an income of less than $26,000. 68% of families have less than $50,000 in income. 84% of Einstein's discharges are Medicare or Medicaid. More than 1 in 5, and you guys all know this, but more than 1 in 5 Philadelphia residents are food insecure, and more than 1 in 5 children in the city are also food insecure. Go ahead and flip the slide. What Einstein has been doing over the last, let's probably say 15 or 20 years, is we've been focusing on trying to address food insecurity for our patient population because we know the impact that it has on their health. So we started about 6 or 7 years ago, really screening for food insecurity along with other social determinants of health. The PAC, which is our pediatric and ambulatory clinic, and Centering used the SEEK tool, which is the Safe Environment for Every Kid. It's a 15-item tool that assesses specific psychosocial determinants of health. Along with food insecurity, it screens for smoking, parenting difficulties, parental depression and stress, parental alcohol and substance abuse, and domestic violence. We use those within our Centering programs and within the PAC. If you want to go to the next slide for me, please. We started screening our patients upon inpatient. So when they're going to be admitted to the hospital, we screen with these 2 questions, which are a standard evidence-based questions. Within the past 12 months, have you worried whether your food would run out before you had money to buy more? And within the past 12 months, the food you bought just didn't last and you didn't have money to get more. If people screen positive for this, we link them to services in our community so that they can address their food insecurity issues. Okay, you can go on. We have a program that is funding Families Understanding Nutrition. It is funded by the USDA. We've had it for about 18 years, and it addresses SNAP eligible families in Philadelphia with nutrition education. So our program focuses primarily on preschool age children. We educate about 10,000 children per week. And yes, we did that during the pandemic when kids were home. We did it virtually. And Kinneret Shakow, who is the director of the program, unlike most of these types of programs through education, she's got her doctorate in education as opposed to nutrition. So she designed this program to really focus on the core curriculum. Well, thank you, Beth. She designed this program with the core curriculum of reading, math, and geography and history so that it can kind of slide nicely in with the schools and what the teachers are teaching. Some of the, a simple explanation would be, if you had a math problem, back in the day when I went to school, it would be Billy had 3 cupcakes and Katie had 2 cupcakes. How many cupcakes do they have together? Well, Kinneret modified that to make it apples or bananas or some kind of fresh fruit. So it really is a different kind of program that really focuses on literacy and geography and history with a nutrition core to it. The program was actually approved by the USDA and is now used throughout the country, which is something we're very proud of. Anecdotally, teachers tell us that kids bring healthier snacks to school after going through the program, and mothers are telling us that kids actually ask for fruits and vegetables at the grocery store. We know with the limited incomes that our patients have, they're very reluctant to purchase fruits and vegetables that their children may not eat. That's a high expense to them. And to purchase them and have nobody in the family eat them is not something that they are willing to do. So part of the program allows for tastings for the children. So they get to taste foods that they wouldn't normally have access to. And then they can tell their parents that, yes, I like this food, please buy it for me. So thank you. Move to the next one. Another program that we just started in December is a medical nutrition therapy program in partnership with MANA. It's designed to help address specific acute nutritional risk factors in patients, such as patients with diabetes or congestive heart failure. And the way the program works is when they're discharged from the hospital, we talk to the patient and see if they would be interested in having these diet-specific meals delivered to their home. And if they are willing to do that, we connect them to MANA, and then MANA enrolls them in a 12-week program so that they can receive specific foods that are appropriate for their diet and their care. And that just started in December, so I really don't have any outcomes for that one. We also have a fresh food prescription program that we do in partnership with the Food Trust. They received funding through the USDA's Food Incentive Nutrition Program, FINI, what we all refer to it as. And what it does is it provides coupons or gift cards to the patients where they can purchase fruit in specifically designated stores and markets, farmers markets, and they can get twice the produce for the money that they spend. What's nice about this program is what we've been able to do is the coupons actually tie back to the specific patient. So when they are redeemed, the Food Trust can then inform us if the patient actually redeemed the coupon, and we can keep track of that in our medical record. Right now, we're doing that program with our diabetes patients in our community practice center, but we are looking to expand it into our centering pregnancy and centering parenting programs in the PAC, and with our Einstein Care Partners, which is our ACO, our outpatient ACO. So go ahead and next slide. And then, of course, we have our partnership with Philabundance, which is Einstein's Fresh for All. We've been doing this since March of 2018, and it is a free farmers market for the people within our community. It's not patient-based. It's just really to help the community. Two of the photos, the top left and the bottom right, are pre-pandemic, where the community members would go through and pick out the produce that they wanted from what we had to offer. And then post-pandemic, what we did was we pre-bagged the food and leave the bags on tables for participants to come by and pick up the food and take it home with them. We also provide healthy recipes for the food that we are allowed to, that we distribute. Because again, some of the produce might not be familiar to some of our community members. So we want them to be able to know how to prepare them in the most healthy and tasteful way. So we also provide that. Since the program launched, we've served 18,000 families in our community with more than 430,000 pounds of food. And we are grateful for our partnership with Philabundance on that project. Next slide. About 6 years ago, as part of the Affordable Care Act, the Einstein and all of the regional hospitals created the collaborative opportunities to advance community health. So it was in response to the Affordable Care Act, where we were mandated to do a community health needs assessment every 3 years and then create implementation plans for the needs that are identified. The first need that was identified by the coach participants was food insecurity. So all of the hospitals in the region have been working to address food insecurity, and we are very proud to be part of that group. So thank you so much.
And hello, everyone. Good afternoon. Happy Friday. My name is Pauline Chung, and I'm the principal here at Francis Scott Key School in South Philadelphia in the Lower Moyamensing section of South Philadelphia. I've been at Key School for 5.5, 6 years, and just really excited that I get to come and serve this community. Also honored and blessed that I get to serve this community each and every day. I just wanted to share just a little, some facts about our community. We have a large immigrant and refugee population. We have the largest populated English learner school in the entire school district, with 71% of our student population being English learners. Most recently, we've been getting an influx of English learners really from Central American countries. And 100% of our students qualify as economically disadvantaged. Food insecurity is known, but it was not widely spoken about pre-pandemic. So just wanted to highlight some nutrition and academic success. And just starting off with the goal that schools can help to alleviate issues of food insecurity and food deserts through education campaigns to support families on nutritious food and partnering with food pantries and other organizations to provide access to healthy foods. And studies do show, you know, when we have access to nutritious foods, it can positively impact student performance. You're going to see an increase in standardized tests, but increase in student moods and behaviors, as well as a decrease in absences. I would like to also highlight some of our partnership. Our folks right here on this call, just as Einstein just preceded me, and we have our nutrition program through Einstein. So shout out to Kinneret and Mr. Some of our nutrition educators who come to Key School. So just looking at our breakfast program, when I first came to Key School, breakfast was optional between 8 a.m. To 8:30. At that time, we started at 8:30. School started at 8:30. It's now 9 o'clock. So at that point in time, any child that wanted breakfast could come into the school between 8 to 8:30 to just have breakfast in the cafeteria. After that, their day began, you know, their academic instructional day began, and that was that. You either got it at 8 or you didn't. And so because of that, we had very low breakfast participation rates. I think it was like in the single digits, maybe right hovering at 10%. So that was a big issue for me, just because we were opening the school early and we weren't really getting a lot of students in to take advantage of the breakfast that was being offered. And then two, students would be hungry, you know, starting the day or getting right before lunch. So, you know, as I became principal, I really wanted to change that and have breakfast part of the day. Like when you start school, we have breakfast. And so what began at first was what began was just breakfast for some students in the cafeteria to now everyone gets breakfast in their classroom. And we have like a system with breakfast ambassadors who are assigned in each classroom who go and get the breakfast each morning and they bring it up to their classrooms. And then we have the same system happening when they bring their breakfast bags back into the cafeteria. So this was just a quote that one of the teachers did share that was highlighted in the Inquirer when I initially made the switch that if kids are hungry, they're not hearing me. They're more alert, they're more upbeat, they pay attention. More kids eating breakfast in school is a total positive. So definitely we see a kindergarten though has breakfast in the cafeteria. So every day they come in, it's only kindergarten, they come in and the teachers take them right to the cafeteria and everyone has breakfast together. So just some of the things we had to navigate and address with the pandemic. It seems so long ago, but it really wasn't, you know, March 2020, and, you know, you thought 2 weeks was 2 weeks and it really wasn't. So, you know, we had to come up with a quick plan. I mean, in terms of like, when we really knew that it was for the long haul, you know, what are we going to do to support our families? You know, they're now like calling the school, calling teachers about so many things in terms of food, health, safety, technology, things that teachers and school staff never really had to interact or deal with in terms of parent communication. And so we knew right off the bat quite quickly that we had families who needed food, who couldn't leave their home, but needed a way to get the food because they either didn't have transportation or, you know, we were in lockdown and we really couldn't go outside and they were scared for their health. So how can we get food to them? So through partnerships with organizations, like we quickly drafted up like a sheet with all the families that needed support with food, that had food insecurity, that wanted to be on a list to get food delivered to their home. We partnered with Christ Church at first, the Delaware Valley Fairness Project, and just really in a very quick turnaround, we had a list of over 100, I think it was like 110 families at first, you know, all their addresses, phone numbers, languages that they spoke. And through Christ Church, we were able to deliver food to the homes of our families and also other families that lived within the surrounding neighborhood, not just Key families. I was delivering food. You know, they need volunteers to deliver food. So, you know, I would go down to, you know, deliver some of the food boxes, and it was just really great to just drop off and interact with families in a different way. I had teachers, as you can see in the photo there, teachers and other school staff volunteering to, you know, when they can deliver food, but Christ Church really depended on a lot of volunteers to get the food out. Then we would have food tents set up in, you know, our front yard. You know, one huge initiative that just recently ended was the daily hot meals from CMAC, the Step Up to the Plate initiative. So that was just a true blessing. And I know that that was also done in partnership with Philabundance too. So that was just a true blessing, not just to the Key school community, but just the overall community. And going on to the next, you can see that we have continued these community efforts. So just because you can say, or you may not say, the pandemic has wind down or not, you know, we still want to continue these efforts. Through Philabundance, we got, you know, we got connected to Michelle Obama's Pass the Love campaign, the Waffles and Mochi Pass. I think it feels like last summer, but it was the summer before that in August. You know, we were passing these boxes out where families can make meals, healthy, nutritious meals together. Lori was there on hand distributing boxes too, very hot August day. Then we are still now able to distribute monthly produce boxes. As you can see, they go so quickly through the Share Food program. We have a once a month fresh produce distribution in our schoolyard during admissions. And then every Friday, you can see the photos, we have our Philabundance weekend meal kits, and they're very popular, beef or fish. I know the whole, you know, I got it down to a science, and, you know, and the kids go home with like a meal packet for the weekend, and families get in line for it. And it's every Friday in our schoolyard at dismissal. And I just want to thank you for the time that you gave me to just share what we're doing here at Key School. And I'm sure a lot of schools are also doing some wonderful things to support their families with food insecurity. And I just want to thank Philabundance and all the other partners here, Einstein as well, who really, we work together to make these things happen. So thank you.
Great, thanks, Pauline. Hi, everyone. My name is Samantha Mogul. I am the Senior Manager of Ending Hunger for Good here at Philabundance. So pleased to be here today to discuss the Hunger and Health Connection and to outline some of the work that we here at Philabundance are doing to advance health equity in our communities. So as Lori had pointed out at the top of the call, you know, our health is determined very little by what occurs in a doctor's office or even by our genetic code. It's really more influenced by our social and economic conditions like housing, like income, diet, exercise, and our physical environment. And we call these conditions the social determinants of health. We know that access to nutritious and culturally meaningful food is part of these social influences and a major driver of health outcomes and life expectancy. You've heard that over and over again from other panelists on the call. The other physical and socioeconomic and clinical determinants of health are associated with food insecurity, of course, both as a cause and also as an effect. We are all impacted by social determinants of health, but our influences vary, often due to our socioeconomic status. Next slide, please. And unfortunately, these influences have very real consequences on the health outcomes and lives of our neighbors. So for example, in Philadelphia, individuals living in Center City or Society Hill live approximately 20 years longer than our neighbors living just a couple miles away in North Philly. We also know that food insecurity rates are highest in neighborhoods with the most poverty and the shortest life expectancy. And these patterns are not coincidences. So we know from research that historical and ongoing structural racism and oppressive public policies are intrinsically linked to worse health outcomes and also high food insecurity rates. So we know from that we can't separate food injustice from economic and racial injustice, and solutions to address hunger must also address these root causes. They say in the medical sciences that the diagnosis determines the treatment, and we can say the same thing is true when tackling social inequities. Next slide, please. So diving more specifically into food insecurity, we've heard today already that both the stress that accompanies hunger and also inadequate nutrient intake, that has metabolic ramifications on our bodies, and that exposes us to higher rates of chronic disease and mental health challenges as well. We know that 1 in 3 adults with a chronic illness are unable to afford medicine, food, or both. And we often refer to that as financial trade-offs. So households with limited financial resources and food may make trade-offs between food and other basic necessities. They may postpone needed medical care, and they may forego medically tailored foods in order to properly manage their conditions. And these aren't just statistics. We see this happening in our communities every single day. Next slide. And these patterns that I just described often create a cyclical nature of food insecurity and chronic disease and poverty. So food insecurity, which is, as I said, rooted in poverty, causes stress and often inadequate nutrient intake, which will in turn trigger biological inflammatory markers. We know from research that long-term chronic inflammation or long-term stress, which also yields chronic inflammation, can trigger chronic diseases later in life. And then we know further that the time and money needed to manage these chronic conditions can often strain the household budget and leave very little money for other essential food and medical care. And this perpetuates the cycle, increasing the risk of worsening existing conditions, and can really impact long-term intergenerational health and poverty. Next slide. So with all of that, and also knowing that food alone is not enough to solve hunger, Philabundance is doing several things in order to advance health equity and to end hunger for good. So in addition to serving on a number of local and statewide and national work groups and coalitions, next slide, please. My team really addresses the social determinants of health and the root causes of hunger through those cross-sector partnerships. We work very closely with housing, with healthcare, with workforce development, with economic mobility coaching programs to really create a more holistic approach to social service delivery. We know that somebody experiencing food insecurity will often also have other unmet social needs. So we work very closely with our healthcare partners, specifically with health systems, Medicaid managed care organizations, and registered dietitians. And we really focus on decreasing visits to the emergency department, increasing primary care visits, improving food security, reducing financial trade-offs, and overall improving the quality of life. We also work very closely with what we often call the heart of Philabundance, which is our agency partners. Through both the Pennsylvania Healthy Pantry Initiative and also the People First Market program. In the Healthy Pantry Initiative, that's a partnership with Feeding Pennsylvania and the Department of Health. We bring nutrition education directly into the walls of our agency partners with one of our registered dietitians. In our People First Market program, we connect people one-on-one through coaching services to much needed health and social service resources. And as far as our direct food distribution, we've also been able to increase the nutrient quality and also corresponding education as well. So we now are able to offer higher quality and tastier kids backpack programming. And we also know, as some have already said, that during the summer when kids aren't in school and receiving meals, there's an even greater need for hunger relief. So last summer, we partnered with Partnership for Healthier America through the Pass the Love program, which provided healthy meal kits along with nutrition and culinary education. This summer, we're also doing our own version of the program called Let's Eat. So look out for more details about that soon. Next slide. Next, we have also been implementing some place-based work, which we call our Neighborhood Thrive programs, where my team really employs community development strategies in really small neighborhoods within our service area. We work very closely with local community organizations and residents as we strive towards a long-term vision of food security and economic stability for the neighborhood. Next slide. And last but not least, and as Lori had already shared at the top of the call, Philabundance is so pleased to have recently announced our good food policy. We believe that everyone should have the agency to choose the foods that are best for them, for their families. And so as such, we have been really focusing on these 4 pillars that Lori had shared at the beginning of the call. And I believe there are some links in the chat for more information about that. So thank you all so much for being here, and I will pass it back over to Lori to moderate the Q&A.
Thank you so much, Sam, Pauline, Principal Chung, Joan, Allison, for a really informative program. There were some questions that came through the chat, and I know some folks are responding. I'm going to ask that we pull down the slide so I can at least see the panelists for the Q&A part. If you have questions, feel free to put them in the chat, or you can use that Q&A feature on Zoom. And I think one question that was asked, and I'm not sure who was going to take this one, there was a question about literacy in terms of reading literacy and how that connects to the literacy programs that we're providing to ensure people are educated about nutrition. And so Sam, as you're coming off mute to pull that, I'll let you answer that one.
Sure. So that is something that we consider in all of our programming and in all of our communication. I would also say that literacy and education is also a social determinant of health, which cannot be disconnected from the other social influence that we discussed already, like food insecurity and housing. And so when we think about making our food really accessible, we also think about how we can make our educational programming really accessible as well. So paying keen attention to the reading grade level of the literature that we're putting out, making sure that any recipes are being culturally responsive. We also know that people communicate in different ways. And so we've been trying really hard to make information available digitally, through videos, through written communication. So we really try to meet people where they're at in a variety of ways.
Great, thank you. And just that's a moment for me also to highlight, I mentioned at the outset that Sam is involved with the Free Libraries Culinary Literacy Program, the Culinary Literacy Center. One of our board members, Eleni Pappas, is also chair of that board. And so we're also talking with them about both types of literacy and how those come together. I'm looking to check for other questions in the chat as I'm looking for that. I did want to ask Allison, at Philabundance, we're committed to advocacy. And could you share some steps we can take to address the issues you've discussed?
Sure. So, of course, there's always opportunities on the federal level, either through the budget or through legislation. Pennsylvania is fortunate to have a senator who is a real champion of anti-hunger issues, Senator Casey, specifically focused on children. And so I know that Senate offices and House offices always really appreciate stories and understanding how the impact of nutrition assistance or other federal federal benefits impact families in real time. I had a staffer recently tell me, I deal with numbers all the time. And when I hear from families, it reminds me that there's people on the end of these policies. And so I think this network really reminding your legislators that there are people on the end of these policies is really important.
Great. Thank you. And I see there are questions in the chat. We will, for more information about how to volunteer, you can visit our website, philabundance.org. We will be sending out the recording and making it available on our website as well. So please be on the lookout for an email from us. Please also then sign up to learn more about our advocacy efforts. And we are, very regularly inviting people to help us talk to elected officials at the state, federal, and local level to advance this work really in support of people who are food insecure. Joan, just for you, it was, and as you're getting ready to answer this, it would be wonderful to see, it's great to see how healthcare has stepped up. Have you seen how these investments really impacted the work at Einstein? And as you answer, I do also want to note that the vice chair of our board is your president and COO, Dixie James, who obviously is a huge advocate and really serves people who are food insecure, as well as your patients at Einstein, and is really a champion of these collaborative efforts and these innovative programs. But Joan, how have you seen these investments impact your work at Einstein?
I think just the investments at all, I think has been a great thing, and Dixie has a lot to do with that. I think that we are, as an industry, healthcare is looking at the social determinants of health and realizing how it impacts our patient population. Just, Allison, you talked about the importance of stories. One of the stories that we frequently tell is that we had a gentleman coming into our emergency department repeatedly because of his blood pressure was through the charts, and we were talking with him and trying to fix his blood pressure and all of that stuff. And finally somebody asked him a question about his diet, and he said he eats soup all the time. Well, vegetable soup, you think, is a very healthy product, but the problem is the sodium level in soup is so high that it was sending his blood pressure right off the charts. So until we actually dug deeper and found out what was causing all of that, we didn't really, it's not something it was in our wheelhouse to say, it wasn't something. People don't come to the hospitals necessarily to learn about food or to get healthy food, but the intersection between health and food is so huge that the impacts that we saw, and like I said, the entire industry, the Philadelphia region, all of our hospitals are working together collaboratively to try to address food insecurity and increase the health status of our patient population by providing nutrition education and nutritious foods to a population that is very underserved and has struggles with this. The food deserts are an issue across Philadelphia. All of that is getting better. So I can see those impacts happening. And I think the awareness and the fact that we're asking the question, we're simply asking the question, are you food insecure? Is food an issue for your family? Is housing an issue for your family? I think the fact that we are now even asking those questions will lead to big impacts in the next, few years as we address these issues.
Thank you. I have a really quick question for you, Principal Chung. I think many of us were that much more impressed by the innovative programs, the way that you're really thinking about how not just to provide food, but ensure that children really are accessing it. You seem to be a leader in this. Is this something that you'd be willing to talk with other principals across this region to help us advance food security? So would you join us in talking with maybe some of your colleague principals across the region to get them to take advantage of these kinds of programs?
Absolutely. I'm always open to share what I know, my experiences here in this community with other principals all the time. They're my colleagues in the field. Although our communities differ, I do believe that we all have the same intention, which is to help our families with food insecurity. And maybe they have an idea that's helpful to me, but I definitely am more than happy to speak with my fellow colleagues.
Great. Well, thank you so much. Thank you again to our panelists. If you look through the chat, there are lots of thank yous. People, as you were talking, you doing your presentations, and now are really appreciative of the work that you're doing and the impact that you're having. So thank you so much, Sam, Allison, Pauline, and Joan for joining us today. Thank you to all of our participants. I looked through and I saw a number of our agency partners. Desiree, I saw you on. I hope it's okay. I read your quote at the beginning of my introduction. I see Maria's on, one of our partners in South Jersey. And also Pauline mentioned CMAC, a partner of ours, and Philadelphia Health Partnership that funds them is on as well. I say that to say one of our values at Philabundance is collaboration. We can't do it alone. To really address health and hunger and those connections, to really ensure that our community has the healthy food that it needs, ensure that we really are advancing health of the people that we serve. We absolutely need all of you. We invite you to visit philabundance.org to learn more, look for our follow-up emails, and we hope that you'll join us in fighting this fight. So with that, I say thank you all, and we'll see you at our next virtual town hall.
Thank you all.
Thank you.
Thanks.
Thank you, everybody. Thank you, Lori.
Good stuff.